Okay, welcome everybody. I think we're live now. My name is Greg Martin. This is the Global Health YouTube channel. You might be watching this on LinkedIn or Facebook or I think even Twitter at the moment. We're streaming in all sorts of directions, but welcome. We are talking about jobs in the global health space. We're doing a series of these live shows where we talk about jobs, answer questions. So if you're watching, you can type in questions. We'll try and respond to them as they come. We've also got some questions that are banked from the YouTube channel, so we're going to talk about those. And we're also going to talk about a few jobs that have been advertised at the moment, current jobs in the global health space and the public health space that we can talk you through and just talk you through what we think about them and have a little bit of a discussion. So that's what we've got lined up. The other thing is we're going to just talk a little bit about jobs in general because I think that there's really two kinds of people that are interested in this video, right? If you're watching this video, either you're an MPH student or you're studying public health and you're wanting to get into the global health space, or perhaps you haven't even studied an MPH, a Master's in Public Health. You might just be an engineer or a banker and you're thinking public health might be interesting to you and you're watching this video. Right, that's the one kind of person. So you're looking for your first job, your first move into the public health space. And we're going to talk a little bit about that. And then there's another whole category of person that might be watching this, and those are the people that are currently working in the public health space or the global health space, and you're thinking about your next step. Where to from here? What is my next career step? And what do I need to do to make that step effective? What do I need to get in place now so that I'm a good candidate for the next job? And so I want to talk a little bit about that as well. And I see somebody's already said hi, Dr. Reddy. Thanks for saying hi. Other people that are watching, if you're and that's from LinkedIn. If you're watching on YouTube or LinkedIn, that's an easy place to make comments. Write comments. We'll see the comments, and we will reply and respond to them. And as much as we can. I mean, sometimes when the comments are coming fast and furious, we can't respond to them all, of course. But we're going to try and keep an eye on the comments, and especially if you've got questions, we'll try and respond to those. Just quickly, we've got with us Kale and Yavna. Both Kale, say hi.
Hello, how's everyone?
And Yavna, say hi.
Hi.
And if you've watched these live shows before, you've seen them. They are two fantastic friends. They're both incredible human beings, and we're going to, amongst ourselves, just have a conversation about some of these things. So while we're waiting for the questions to come, and please feel free to type in questions. I think the more we can be interactive, the better, right? This is the internet, it's supposed to be interactive. Let me just give you a quick, in a nutshell, what my thoughts are about those two categories of people, the people that are kind of wanting to get into global health or public health in the first place, and the people that have already got jobs. If you're looking for your first job in the public health space, the biggest problem, the most common question I see, in questions on my YouTube channel, in the discussion section, people often post questions. The most common question I see is, how do I get experience if I haven't got experience? I can't get a job at the WHO because you need experience to get the job, but how do I get experience without the job? That chicken and egg thing that everybody always talks about. There's no easy way around that, right? It might be that you need to do an internship or volunteer work to kind of clock up that little bit of initial experience. And I know that's difficult, especially if you need to have an income. The alternative is you can carry on doing a regular job that's not public health, but in your spare time, be doing something that indicates an interest in the public health space that you can use to clock up what will be considered experience when you interview for that first public health job. And I mean, you could be writing a blog. You could start a podcast, you can start a YouTube channel, you can help me with my YouTube channel. That's a big tick, hint. There's lots you can do in your spare time outside of the context of formal employment that you can clock up and point to as experience. I do a lot of stuff that's outside of my day job in public health. I do this. I'm an editor of a journal that, I don't get paid for that, but that's just something I do in the background. But it's something I point to in every job interview I go to. So if I'm getting interviewed, I tell them about my work with globalization and health and the work that I do on YouTube. And I think it really stands me in good stead. Right, so that's the person looking. And the other thing about the skill sets that you need to get together for that first job in public health, at that point, you're trying to clock together mostly technical skills, right? You want to have a deep working knowledge. If the job you're going for is in a particular disease area, you want to really have a deep knowledge of that disease area, and you want to get to that first job interview able to really kind of clock up, talk about anything in that space comfortably, right? It might be a job that involves the kind of work you might be looking for might be sort of technical. In other words, you might need to know epidemiology, data analysis, health economics, something like that. you look at those technical skills, that technical knowledge that you want to you're coming to the game with. That's not the case when you're looking for jobs after that. I mean, that is always the case. You always want to have those skills. You want to be working on them. But as soon as you start progressing in your career, suddenly what starts becoming important are management skills, right? How do you manage performance of staff? How do you manage change? How do you manage risk? How do you manage resources? How do you manage budgets? Especially as you get into more and more senior jobs. And if you're in a current position, you want to be looking for opportunities to get experience in those areas so that at your next job interview, you can point to things that you did in this job that illustrate the skill sets that you've got that make you ready for the next job. In other words, look for opportunities to manage resources, to manage change, to manage risk, to manage people. Look for those opportunities, take note of them, and then that's the stuff that you really want to get together as you progress in your career. Okay, so I see lots of questions coming in, and we're going to come to those in a second. And Yavna and Kale, if you don't mind keeping an eye on those questions just while they're coming in, and we'll start. In fact, are there any good ones any questions that have come in so far that we can already start kind of responding to, and then we'll get into the other things that we're going to talk about in a second?
I actually see a lot of good ones.
Okay, hit us with a good one, Yavna.
Well, Well, first thing is maybe what's your advice for professionals who are looking to switch career paths to public health?
Okay, you know what? I'm going to ask you guys, the two of you, what you think about that. But I've also got some thoughts. Kale, any wisdom from the Antipodes?
No tips. I guess having what you've talked about, that kind of motivation, interest, knowing a bit about the landscape and the things that are important in the global health space is all very important. It's a little bit of experience in whatever capacity is great. Having experience in whatever field it is, not necessarily global health field. Like if you're an HR expert or something like that, having HR experience somewhere else does count. But I think having that experience and combining it with an interest and motivation and showing your interest and motivation in global health is very important. Obviously, if you can get some sort of experience, be it volunteer, internship, whatever, that's also great. And I can see a few other people asking about that as well and how you do that. And we can talk a bit more about that. But that's my thoughts.
Yeah, Yavna, any thoughts?
Yeah. Well, my thoughts are that you can always build upon transferable skills. English.
English. Who would have thought?
Because, for example, if you're a good communicator, that's always a plus, whatever you decide to do in your life. And also, like, besides the hard skills, you always need a soft skill set. So,
Yeah, that's true. So, look, this is a common question. In fact, it's maybe the second most common question after the "How do I get my first job?" question. Like, I'm an engineer, or I'm a banker, or I'm a musician, or I'm an astronaut, and I'd like to work in public health. Actually, we haven't had the astronaut one, but watch this space. We might get it one day. Now, what Kale and Yavana were just talking about is exactly right. Wherever you've been working, you have developed a set of transferable skills. I promise you, you have. You might not know it, but think it through. There's something that you do that is useful in the global health space or the public health space. Because a lot of what we do in public health is operational, right? There's a few people that are thinking through the epidemiology and coming up with a strategy and thinking through what we need to do. After that, everything is about implement. In other words, we need people that are good at M&E. We need people that are good at communications. We need people that understand numbers. So you're a banker, you're good at numbers, we want you. You're from the advertising agencies, you're good at communications and talking people into do things. We want you in health promotion, get people off cigarettes. You're a musician, you know what I mean? And you're an artist. You might have ways of thinking about the world and interpreting the complexity of the world and the complexity of decision making that will be useful in terms of communicating public health messaging. You're an astrophysicist, just to come up with a ridiculous suggestion. There are aspects of public health, and I just have to think of one quickly. Mass coronal ejections, right? The sun every now and again has these kind of big mass coronal ejections. There was one in 1750 something. It was called the Carrington event, and it knocks out all of the electricity if it hits the planet. And you have them hitting planet Earth every kind of 300 to 500 years. We're kind of due one now. If we get one of those, knocks out all the electricity, like everything gets fried, and suddenly you've got hospitals and healthcare systems that, with all the computers gone, what do we do then? We actually need people from those backgrounds to be at the table talking to us about preparing for these kinds of disasters and emergencies. I know that's a little bit melodramatic, and we're in the middle of like our own flipping pandemic at the moment, so you might not want to hear about this sort of thing. But the point is, whatever you're doing, you've got transferable skills that are useful in public health. Now, you might need to add a layer to that. So you want to add in a little bit of, okay, I need to understand epidemiology and I need to understand some of the lingo in public health. Fine, you do an MPH, it takes you a year, it's not the end of the world. But you come out of it with a real combination and a really useful combination of skills that I promise you we will use. So absolutely. So all of that transferring from some other career into public health, the answer is yes. Yes, 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 and again, yes. We do want you, come to us. Okay. Any other good questions on the horizon right now?
Well, sorry, can I just add something? Sorry, Greg.
Yeah, jump right in there, Kale.
Great. What you're kind of saying is that there's just such a wide variety of opportunities in global health, because it's global. Someone here, I just saw someone asked about oral health. Is there opportunities in global oral health? And of course there is. Global oral health is extremely important, but even if it was something more niche, like there would be a place. I guess it just takes time to kind of find that place, and knowing the right people, knowing the right organizations.
Yeah, I absolutely agree with you. And the thing is that the global health landscape is so diverse. There's so many organizations that all that's missing is you might not know about the particular niche or the organizations that you're interested in. And that leads me to a quick advert for people that are looking for jobs in global health or wanting to expand their careers in global health. I have a way that I can help you now. In order to do that, what I'm going to quickly do is switch this on, and I have to switch off my phone. Someone's phone. A friend of mine's phoning who should be watching. Hello. Okay. So now, if I just do that and this, what you're seeing on the screen at the moment is my YouTube channel has got a membership option, right? So if you become a member of the YouTube channel, you get access to videos that other people don't. And all of those videos are specifically about jobs and careers in the global health space. And I'm going to be making many, many more. Those videos are less well polished and produced than my usual like YouTube videos, which, I go to quite a lot of trouble to have all sorts of flash bang, yada, yada. These videos are much more simple. It's just like kind of me talking to camera. But we really get into the nitty gritty of like jobs and careers in the global health space and the global health landscape. So that's the one thing about the membership. The other thing about the membership is members get access to a web page on which current jobs that are being advertised in the global health space are put. So, and this is kept current, and we've got a team of people that are kind of keeping it current, and the links to the jobs there. The due date is usually there. We're also going to be sticking consulting work onto this list quite soon. So this is going to become a really, really good resource for people that are interested in global health and they're interested in their careers in global health. Okay, so that's my little advert. Go to the YouTube. I think it's youtube.com/Dr. Greg Martin or C. Anyway, look, you can find my YouTube channel. You're probably there already. The membership option gives you access to all of that. That's enough of my advert. Moving right along. Next question. Have we got any nice questions coming out from the audience at the moment, Kale and Yavna?
We have plenty. Yavna?
Yeah, I know. It's kind of like there's almost too many at the moment.
Yeah, I'm hoarding questions. Well, there are questions about, like, for example, in India, people express that there are like not enough opportunities, and that opportunities are quite limited. So, what can people do if their their country isn't offering, and where to look next?
Yeah, I mean, it's so there probably are more jobs than you realize. It's just about a matter of looking in the right places. Look, I was faced with a little bit of that when I first moved to Dublin, because I moved to Dublin, I'd been working in the global health space, and I was looking around thinking, well, how do I find that kind of job here? And of course, I was physically in a different place, and the same kinds of jobs that I'd been used to working at didn't exist in Dublin. But once I'd taken a little bit of a step back and understood the landscape and the environment here, there's been loads of opportunities, and of course I'm extremely happy with my career here in Dublin now. So it might just be about looking around. I can't speak to India offhand, but that's a big country with lots of public health stuff happening. So I imagine that there are opportunities there. It also might depend a little bit on the extent to which you're able to travel and move. So if you are able to move and travel, you could work with a global NGO of some description and work somewhere else, but you might not be able to for personal reasons, in which case you kind of have to look local, which I understand. It's not always easy, and I'm not proposing that getting a job in global health, especially your first job, is always going to be an easy thing to do. It's sometimes a difficult space to break into, especially if you've got constraints like you can't move and you need to work where it is that you live. So I understand that not always an easy solution. Shall we, before we take the next question, Yavna, you've looked at one of the jobs that's being advertised at the moment, so a current job that's out there that people can apply for. Would you just quickly talk us through that, just so that people get a taste of the kinds of jobs that are out there, and and this is current, so people that are watching this right now can apply for this particular position?
So I'd like to present a role within Women in Global Health. In case you haven't heard of them, it is a global movement with largest network of women and allies working to challenge power and privilege for gender equity in health. So overall, this is a great career switch, great for career switchers and creative communicators. And the role is surrounding communication, content creation, external outreach, and project management. Um, they're looking for someone with 3 to 5 years of experience, but it's like at least 1 year with managing social media and producing digital event communications and content. So it's not too ambitious. And this is like a full-time job, which is anticipated to start late May. And due date is May 20th.
And tell me, are they requiring that you have an MPH, or are they just happy with 5 years of
No, no,
experience,
no,
at
no.
least 1 year in social media?
Yeah, it's just like if you have experience in content creation and social media, you're encouraged to apply. So this
Okay.
is a great way to kind of join global health if you don't have an education or background in global health exactly.
Okay, that's fantastic. And so there are actually job opportunities in the global health space and the public health space that don't need you to have an MPH. And I certainly, even when I worked at the World Health Organization, I worked with a lot of people that didn't have masters in public health, and I worked with some who joined the organization and then did a part-time MPH in the background in order for them to kind of take the next step in their career, which is also fine. It's not, and that's not easy, by the way. That's quite a difficult thing to do, but it's certainly doable. It just reminds me of another question I get asked quite a lot of, and that is, do you need to be a medical doctor to be working in public health? And the answer is absolutely not. There are so many opportunities. There's so much of public health that doesn't require of you to be a medical doctor to work, to do these jobs. That if you're from some other discipline, like there is loads of opportunities for you to work in public health. There are some countries, like here in Ireland, we do have a speciality. So, in the same way that you can specialize in surgery or pediatrics, you can specialize in public health as one of the medical disciplines, and that's fine, and that opens up, a certain number of doors. But for most countries, most of public health is done by people with MPHs and DRPHs and PhDs in public health. Thanks very much for that, Yavna. Anything else about that job that you want to highlight? I think I might have cut you off midstream there. I don't know.
Well, if you join Greg's special members community, you can find this job in our database.
And I'm sure that it's also available on the internet for everybody
Oh
else.
yeah, you have it online too.
But my preference would be that you join the community, of course. Thanks, Yavna.
Yeah, if you just look
for
up for women in global health and job openings, they should be available.
Okay, very, very good. Kale, you also had a look at a job in the
Yep.
global health space that you were going to highlight.
Yep. And something I've just noticed on all the questions coming through, a lot of people are talking about PhDs quickly. I know you've talked about PhDs previously. I do have a job lined up too, by the way.
Yeah.
You've talked about PhDs before and whether they're necessary for global health. I'm guessing the implication from saying that people you met working in global health didn't have an MPH. A lot of people also, I'm guessing, don't have a PhD, not needed. Like a PhD isn't essential. I'm guessing, like that's what we've kind of talked about in previous sessions, but a lot of people seem to be asking it still. So
Yeah, yeah. Well, why
curious
don't I
quickly.
quickly address that while it's on the table, and then we'll jump into the job that you've prepared, Kale. Look, the
Yeah, sure.
PhD story is this, in my opinion, and people may differ on this particular subject, but if you want to work in an academic environment in doing research, right, and you want to work at a university, then doing a PhD is almost essential. It's very difficult to have a career in academia without a PhD. If you don't want to work in academia, then a PhD represents quite a substantial opportunity cost. It's going to take you 4 years at least, usually, to do a PhD. And that's 4 years that you're not working and you're not clocking up experience. And so there's an opportunity cost in doing a PhD. And look, a lot of people might do a PhD with a view to not working in academia, but being a kind of a policy expert in a particular niche area. There's nothing wrong with that. People do that. You need to be sure that that's what you want to do, because it's a huge undertaking. I mean, it's really, I haven't done a PhD, but I've seen people do them, and it's a massive undertaking. And if you're not going to work in academia, you need to be, I think, quite cautious about doing a PhD with a view to kind of then getting, because look, you could get hired with a PhD as a kind of subject matter expert, for sort of policymakers. But mostly when you do a PhD, the subject matter that you land up studying or doing your PhD on is actually kind of a function of the interest that your supervisor had. Like there's not many people that do PhDs that actually get to sit down and invent their own real, research question. I mean, like you have, I get the impression you've got more constraints than is necessarily appreciated. So I'd be cautious about doing a PhD as a stepping stone into a career in public health unless you've got a very kind of specific game plan. I don't know, Yavna, Kale, any thoughts on that particular question?
I think you're very adept to answer this.
Well, yeah, I'm actually like doing a PhD on parallel with doing a lot of things.
Just in your
But
spare time. Oh my goodness.
yeah, it's literally my hobby. But I agree. I think you need a PhD to like have a successful career. Experience is also like really valuable, and you need to be like really motivated to do a PhD because, as Greg already mentioned, you need to kind of let go some other things, and also, yeah, it's quite demanding. So you need to be like really interested and motivated to do a PhD.
Yeah, yeah. It's not. It's a huge undertaking. Some people. I mean, I'm sure there's people that are much cleverer than me that for whom it's a walk in the park and they just kind of like, breeze through it. But I've thought of doing a PhD, and the thought of it kind of scares me a little bit. Um, Now, you know what we can do? We can switch on the chat overlay so other people can see the. Can people see the chat? Okay, it's kind of switched it all off. It might still come. Okay, let's switch it off. It's easier to kind of look at us like that. Okay, so Kale, over to you.
Yes.
Talk to us. Hit us with the information about the job.
Great, great. Well, I saw someone asking in the chat earlier about the kind of global burden of cancer worldwide in global health. So one of our lovely volunteers has found this job in Senior Research Interpretation Officer in the World Cancer Research Fund. So the World Cancer Research Fund is a big not-for-profit NGO that works on cancer prevention worldwide through a network of different organizations across many continents. They're mainly kind of science and policy based, but also work on kind of strategic direction for charities and organizations. So this job, it's a bit more senior than the one that Ivana talked about just before. This one is kind of a 5-year experience job, and it's a senior research interpretation lead, so officer. Sorry, so there's a fair bit of kind of work experience and independent initiative that would go into this sort of position. So the job is based in London. it doesn't say anything in this job description that I can see about particular need to have a visa or anything for London, like whether it's supported or not for people who are trying to move there from other countries, but I'm sure it might be in the more full job description. But this job is very much about the evidence base for cancers worldwide, and looking at the links between diet, nutrition, physical activity, and weight, and planning this thing called the CUP, which is kind of their policy plan there at the World Cancer Research Fund. Sorry, it's a lot of words. It's actually World Cancer Research Fund International, but so the role is to be a main person on that secretariat. For that role, it does require a master's. They said preferably in nutrition or public health or a relevant subject. And I think the relevant subject is where the kind of where other people can come in, oral health, that kind of thing. I think that's a relevant subject personally. Need experience in writing scientifically and editing, proofreading, good attention to detail, experience in scientific research, and kind of coordination abilities, and all those kind of softer skills about, constructing an argument, thinking concisely, and presenting clear arguments. And there's also some kind of administrative functions within that. And it's a permanent role as well, which is good for a lot of people. I've seen some people commenting on the contract basis and short-term basis jobs. This is a permanent role, and it's in London. So yeah, that was something I
Okay,
thought.
so I don't know if you knew this. Okay, oh, there goes my. I don't know if you can still hear me. Can you still hear me? My camera just switched itself off, and it's about to switch back on. I have this just so that people know. I've got my computer plugged into a DSLR camera, which just switches off and on randomly. So that's what happens if I disappear. You know why. Kale, I don't know if you knew this or not, but I used to work at the World Cancer Research Fund.
Right.
So this is quite a long time ago, in sort of 2003-ish, 2003, 2006. I was the head of science and research there. I know that team extremely well. And I have very, very fond memories. So if people are interested in working there, I can give it my heartfelt endorsement as an absolutely lovely place to work. They do incredible work. It's a great team. It's got really good leadership. The team in London is kind of a smallish team, but they've got loads of reach, and there's so the international team's in London, but they've actually got World Cancer Research Fund offices in multiple other countries. And so you've got a lot of kind of international exposure and collaboration and working with colleagues in all sorts of contexts. It's a really, really nice place to work. Highly recommended. So that's a nice find, Kale. Thank you for that.
Thank our
Okay,
volunteers.
so I see I'm just looking at a question. So what are the main skill sets for a PhD student in public health should aim to gain? And that came from I'm not gonna try and pronounce the name. I'll get it wrong. I won't pronounce it. I will get it wrong. So I'm just gonna just time travel, go back, ignore what I've just said there. If you're doing a PhD and you're thinking, well, what are the transferable skills that I can get out of this? Because I don't necessarily want to work in research. I want to work in public health. I'm doing a PhD. The transferable skill set that you're getting is a very good understanding of research methods. And you're getting, depending on what kind of PhD you're doing, but you might be really clocking up strong quantitative skills, for example, that are useful in other contexts. So you're clocking up really useful skills. You're clocking up skills in terms of project management. A PhD is a big project. Depending on the kind of research that you're doing, you might be clocking up skills in the area of resource management, performance management of staff. It depends on, you might be managing a team of people that are collecting data for you, for example. The PhD might run into trouble at some point, and you might need to change tack. So you can say you're going to learn about change management. In drawing up your PhD plan, you need to think about risk, why things might work or might not work. So you're learning about risk management, coming up with a risk mitigation strategy. You're learning a whole lot of skills while doing your PhD. You just need to take a step back, think about what those skills are, and put them down on paper so you can talk about them in a job interview. I don't know if that was a good answer. Okay, how are we doing? What's the time? We're half an hour in. I don't want this to be too long, so we're going to kind of aim at We're probably going to aim at sort of 45 minutes, but I don't mind too much if we go past that. Or if we stop before then, if we run out of things to talk about, that's fine as well. Any other questions that are jumping off the page that might be good to talk about? They're moving along. Should I?
I'm just noting, Greg, like a lot of people, too many to even kind of recount, are talk and asking. And sorry, someone said my microphone wasn't very clear. A lot of people are asking about their particular skill set and what they can do in global health. My kind of reading of a lot of these jobs and a lot of the ones we talk about is that a lot of them say masters in public health and masters in nutrition or something relevant. You have a lot of experience in global health. What's your kind of take on when they say a relevant masters or a relevant experience or something like that?
So the question about, because people often ask, should I do a master's in this or a master's in that? Like, I could do an MSc in epidemiology, or I could do an MPH, or I could do an MSc in international health, or and there's all. I don't think it matters too much. I think that if you've got a master's level degree in something connected with public health, it could be it could be epidemiology, it could be an MPH, it could be an MSc in international health. I don't think that matters too much. I think when you're applying for one of these jobs, usually, I know at the WHO they used to say an MPH or equivalent. And by equivalent, they just mean a master's level degree, and not just in anything. Like if you've done a master's in like music theory, okay, well that's not going to work. But in anything kind of health related is probably fine, so long as it's sort of tangentially related to the kind of work you're talking about. But I wouldn't worry too much about the exact master's degree that you do. A master's or equivalent is usually fine. In all of these public health related master's degrees, they're all going to cover the sort of basic sciences that underpin public health. The most important thing you need to get your head around for a career in public health is epidemiology. I mean, after that, like everything else is window dressing, in my opinion. Like epidemiology is the science that underpins public health. Epidemiology is our understanding of the distribution and of disease, and the distribution of the cause of disease, and what it is that we can do to change that. That's epidemiology. Everything about public health comes from that. If you've learned some epi, you're good to go. You know what I mean? I'm being a little bit facetious, but then in terms of the relevant experience, that's also a little bit of a vague term, and I think certainly at the WHO, as an example, they're quite strict about that. So WHO jobs, and the reason they are is just because of the sheer volume of applicants that they get for any particular job. So if it's a job in working in tuberculosis and monitoring and evaluation of a TB program, and it's a sort of a P3 level job, they want 5 years of experience doing that. Like not something kind of like that or similar to, or you had a cousin. No, they want you to have 5 years exactly, not a day less. If it's a day less, you're not eligible. And the reason that I'm saying this to you is just a lot of people apply for WHO jobs. They see the job being advertised. They think to themselves, I'm perfect for that job. Look at, like, I'm the right person for that job. And I'm nearly eligible. I've got like 4.5 years, and I'm sure they won't mind too much that half a year. How much can that matter? And the truth is that half a year doesn't matter in terms of your set of skills and your ability to contribute. But understand that your application is landing on a pile of hundreds of applications, and the first people that are reading it are human resources, who aren't going to be looking at it and understand that you're passionate and you really believe you're the right person and blah, blah, blah. They're just saying there's a list of criteria, there's tick boxes, and if you don't meet those criteria, you're off the list, because they want to get it from hundreds down to a handful that they can hand to the hiring manager who can make a decision. So for the WHO jobs, certainly the degree doesn't really matter. Master's level and above is fine. The experience has to be quite specific. Other organizations, non-UN agency organizations, will be, I think, much more flexible in terms of the kind of experience that they would necessarily. There's a little bit of screaming in the background. Those are kids, and if any minute, if they make it through the door, you might get to see them climbing all over the desk. So that's a bit of a long-winded answer to your question, Kale, but. I can't even remember the question.
Okay, so we could have just
Kale, do you want to talk through, because I know you've looked at one or two jobs that are out there that are being advertised at the moment.
Yeah, absolutely. A lot of people are commenting kind of where can you find jobs. Obviously, this is something we do semi-regularly and we highlight some jobs, but the very, very slither of what's out there globally. Some people have asked particularly about internships and volunteering. I subscribe to a site called Relief Web, and that's great because they've got so many jobs. And they also send a twice weekly email, which kind of just lists all the jobs, listed by country, and there's hundreds. So it has internship, it has volunteering, it has everything from entry level to senior expert, whatever, in many places in the world. So I highly recommend Relief Web.
Relief Web's great. It's
great.
a fantastic site. Agreed.
Excellent.
Yeah. The other thing, just on that, like people looking for internships, etc., go to we did a live show like this specifically on WHO jobs. So if you go to my YouTube channel, find the video on WHO jobs, and we go in that video. We actually take a look at the WHO webpage and where it is that you find or did I make it as a separate video? Anyway, somewhere on my YouTube channel, it's there. I can't remember if we did it on this live show or if we just created a video about it. But the WHO webpage, where you look at jobs, you can search by internship or full-time job, part-time job, consulting work. You can actually do quite a refined search. I see quite a nice question that's popped up there. How has COVID-19 impacted the global health work, and how has this impacted the current jobs in the global health space? I think that's super interesting. And until reading the question, I hadn't given it much thought. And I'd be interested, Yavna and Kale, what you guys think. But I think COVID-19 has been a game changer. The number of jobs that'll be made available in the not too distant future in the health protection space, in pandemic preparedness space, in monitoring and evaluation of pandemic preparedness plans is going to be substantial. I think there's going to be loads and loads of jobs. And there's also like access to medicines, access to vaccines. That's a big deal. How do we get vaccines that are under patent to be made available in countries that maybe can't afford them? There's just a host of interesting questions that are going to be asked, and there will be loads, and money will be made available because people have been really shocked by this pandemic. So there's going to be resources those resources will translate into jobs. COVID-19 has definitely been a game changer. Even here in Ireland, all of the departments of public health are, suddenly staffed up to the hilt with human beings that just didn't exist before because of COVID-19. And COVID-19 is going to be here for a little while. So I'd say interesting jobs available, and that's a great question, by the way. Thanks for asking that question. I didn't see who asked it, but super good question.
It's a fast-moving chat.
What Yavna, Kale, what are your thoughts? COVID-19 jobs in the global health space?
Well, I think COVID-19 kind of opened a lot of space for new ideas and innovation. So there's like room for more creativity within the field.
Yeah. I wonder if it's going to negatively impact job opportunities in non-infectious disease career paths. So people that that are interested in health promotion and tobacco and alcohol and that sort of thing. I don't know. I'm just speculating that a lot of funds might get diverted to pandemic preparedness, in the same way as at the height of the HIV pandemic. That's where all the money went, and and we almost are kind of like, if we didn't know about if neglected tropical diseases weren't neglected before, they got properly neglected because so much resource got poured into HIV. Now I understand why HIV was a very scary thing, but it could be that we overstepped the mark slightly, and we pour too much into. I mean, it's difficult to imagine pouring too much into pandemic preparedness because it's so scary.
That's a kind of crisis response, though, isn't it? Once you kind of stabilize that, because health promotion is, if there was more funding in health promotion before all of this, we probably wouldn't have seen the morbidity and mortality from COVID that we've had. It affects people with comorbidities.
That's true. That's true. That's true. I see somebody asking, what is your YouTube channel? That's Stephanie. Stephanie, if you go onto YouTube and you just search for global health, I'll pop up somewhere. You'll see a little picture of me somewhere. Click on that. It'll take you to the channel. I mean, the channel is found at youtube.com/c/Dr. Greg Martin. You can type all of that in, but if you can't remember, just search for Greg Martin or search for global health. You'll find me. Another nice question that's popped up for UN WHO jobs. I heard that knowing the right people is more important than credentials in terms of accessing opportunities. Is that true? Yavna, Kale, what do you guys think?
From what I've heard, mainly from you.
Exactly.
Yeah, no, it is true. Knowing the right people is important. And I'll tell you why. And we've talked about this before, but just to reiterate, the easiest way to get into work in the UN agency is to first do consulting work. So you do short-term consulting work. So you don't have a job, but you've got a short-term consulting job, and that very often translates into them needing you. You've become part of the team, and they will often create and advertise a job, and you're the incumbent, and you're much more likely to get it than a cold applicant from outside. That is, just having worked at the WHO, I saw that a lot. I very seldom, and I'll be honest, in the 2 years that I worked at the WHO, I didn't know anybody that got a job just as a cold applicant that applied to a job on a website and they applied, interviewed, and got the job. I'm not saying it doesn't happen. I'm just saying I didn't ever see it. So yes, knowing people is important. And so network like crazy. Get onto LinkedIn, make friends with people, ask them questions, like really reach out. That's what networking is all about. Don't annoy them, but make those connections. And another, like, I don't want to be over killing my little advert for my YouTube channel membership, but one of the perks that I give to my members of the YouTube channel is I allow them to connect in with me on social media and LinkedIn, and they can send me questions, and I'll respond to those questions specifically. So and I can help you network on LinkedIn if I can. I mean, I'm happy to help people wherever I can in terms of just putting them in contact with people that, if they're looking for somebody that works in a particular organization. Yavana's got a little sign with a 3. I think that's a heart.
Yes.
Kids today.
Greg, I've just noticed something else, if I may interject as well. There seems to be a few people, even local people here in Ireland, asking kind of what is, like, again, so what we were talking about with COVID, like what will be the opportunities after COVID for people who have been involved in the COVID response. We had a question from one of our contact tracers here in Dublin who said, for a contact tracer, what will we be able to do after this? And some other people mentioned about the kind of, lack of opportunities in certain countries, including Ireland. Any advice on that in the post-COVID world, depending on what happens?
Yeah, that's a good question. And it is likely, actually, if you think about it, we've brought so many people into, like here in Ireland, we've got 850 people working in contact tracing. And when COVID-19 settles down, we are not going to have 850 posts in departments of public health to work in contact tracing. But look, I'll tell you what the good news is. COVID-19 isn't going to just stop. I mean, we've got the vaccine program kicking in now, but what's going to happen is it'll become endemic for a while, and maybe we will or maybe we won't stamp it out completely. And so over time, people will either get absorbed into other jobs, or they'll still be sort of contact tracing work. There'll still be these additional jobs that are required in the public health space going forward for a little while. But it is true. I sympathize with the sentiment that's being asked there, is that there's so many people that have been brought into public health during COVID-19. Are there going to be that many jobs at the end of COVID-19? And the answer is probably not. So if you're working in public health because of COVID-19 and you want to stay working in public health, if I were you, I would start trying to staple on some additional skills and additional, do a part-time course, start getting some certificates. There's a lovely little web page called learnmore365.com. It's my web page, and you can do courses there and you get a certificate. See, I'm just advertising stuff left, right, and center. I'm embarrassed. But the point is, start clocking up getting your CV in place so that you are a little bit more competitive, because there will be more jobs than there were before. I think pandemic preparedness is going to be a big thing going forwards. Health protection is going to be a big thing going forwards, but there won't be as many as there are at the moment. So it's a good point. I mean, I think it's a realistic thing to start thinking about now.
But still, there'll be a lot of transferable skills from the people who have worked through this as well.
Yes, exactly, and you are picking up transferable skills through just your involvement. You're getting to know and understand public health, which you wouldn't have otherwise.
Absolutely.
Yeah, I agree. And I mean, I must say, like, I'm working with contact tracers all the time now, and I'm so impressed with the level of dedication and the work ethic, and like they work so hard and they do so much good. I am deeply impressed with the contact tracers that we've got here in Ireland. They're an absolutely amazing bunch, because we change things all the time and they just learn it, change it, do it. They're absolutely amazing. Very impressed with them. Okay, let's see. Other questions that are popping up?
I can talk about a job if you want to look at that.
Yeah.
I'll talk
Kale,
about
jump
job.
in, talk about a job that you've looked into.
Yep.
That's current, yep.
Okay. So another one we've got here is from a Dutch agency called, I'm going to say Wemos. Could be Vemos. I'm not sure. Or anyway, it's a job based in Amsterdam. The organization appears to be based in Amsterdam, but it's international as well. So an international consortium. And this job particularly refers to COVID-19 and COVID-19 going forward. The title is, so if you want to Google it, Vemos, and it's Senior Global Health Advocate on Access to Medicines. So Vemos is about mobilizing political support and coordinating access initiatives worldwide, and very much involved in influencing governments and advocacy. Advocating towards governments. So this job is kind of a part-time job, 32 hours a week. There are multiple parts of the job, but one of them is coordinating a team. One is coordinating the program, the COVID-19 innovation program. Another is lobbying and advocacy, and another part is fundraising. If you look at the job description online, there is quite a bit of detail into each of these parts, so I won't go through all of them, but those are the broad kind of overview of them. It's based in Amsterdam, as said, but for now they're doing a kind of hybrid remote Amsterdam setup, and you work with a team of policy researchers, communication specialists. The contract's for 1 year, and the salary is based on experience and background, which is always always interesting. Again, masters or higher, and this one's quite an advanced level, 5 to 8 years of demonstrated experience in public health, access to medicines or related areas. But again, related areas, there could be many different things. Need a command of English, excellent analytical skills, capacity to lead an international consortium, good writing and admin skills, and an EU work permit, unfortunately. Yeah, so that's quite a high level job, but it sounds quite good as well.
Okay. Thanks very much. Thanks, Kale, for that. So interesting stuff. And the jobs that Kale and Yavana have been talking about, these are jobs that are currently being advertised. You can apply for them now, today. Get in there, get your CV together, and hit it. I've just seen there's quite a nice little feature here where we can show a person's question. So that question, there you go. So John asked the question: if you study an MPH, is it possible to get consulting jobs? And the answer is absolutely yes. Let me just say, consulting work, people often think of consulting work as like McKinsey and Company or Bain and Company or Boston Consulting that swoop in and do high level strategy. No. Most consulting work is there's an organization that needs a little bit of extra horsepower. They need a pair of hands. They've got a project that's behind times. They need more people to help them get it over the line, or somebody's left. There's some reason why they need a consultant, or there's a particular piece of work that only needs to be done for a short period of time. They don't need a permanent member of staff to do that, but they need that done right now. It's not, most consulting work isn't this sort of, this high level, high powered strategy stuff. It's just they need somebody to get into the team and work, and it's usually not that. I've done quite a lot of consulting work. None of it's that difficult. It's the only difficult thing about consulting work is that you're usually working against quite tight deadlines, right? So you kind of you sort of have to be able to drop everything, work hard for a short period of time, and it typically pays quite well. If you've got an MPH, you can absolutely do consulting work in the global health space and in the public health space, and there's lots of it out there. And I'm going to start on that page that I showed you earlier that the members of my channel have got access to. I'm going to start posting consulting jobs there because I know people often struggle to find consulting work. And it's out there, they just don't know where to look. And it's actually not that easy to find it. I understand that that's difficult. Okay, now how do I get that question to go away? Do I click up? There, it's gone. Well done, me. Okay, other questions?
Yeah, I've seen one here as well, Greg. Perhaps you can highlight it. I don't know. That it says, do your years of study in a master's and PhD add up to experience?
Usually no. So so the year that you were spending as an MPH student, you I don't think you can clock that onto the years. Certainly you couldn't at the WHO. You couldn't use that as a year of experience. Now, someone like Yavna who's doing a PhD, but she's also working and doing stuff. She's kind of like, she's doing a million things. She's clocking up experience at the same time. But if you were a full-time PhD student, there might be some context and there might be some organizations for whom that clocks up as, there might be exceptions, but for the most part, no. Are organizations like the CDC and the ECDC open to international applicants? Yes, they are. So the short answer is yes. And at one point I was applying for a job at the CDC in the States, and my application got there a day late, so they wouldn't accept it. But so I know for a fact that the CDC in the States do offer jobs to people from other countries, and I'm pretty sure the ECDC do as well. There might be certain jobs in which that's not the case. I'm not sure, but for the most part, I'm pretty sure that they do, and certainly the WHO does. Well, of course, the WHO does. Yeah.
A lot of European Union NGOs need a European Union work permit. I have not seen a lot that say they offer sponsorship, which is quite an important point for people. Yeah, who come from non-EU or EEA countries rather.
Okay.
So it is something quite important.
So there might be some NGOs that within which, in order to work in the country where the job is, you need to have a work permit, which might mean that you need to either get sponsorship or have existing citizenship in one of the EU states. That's interesting.
Yeah. But that's kind of on a case-by-case basis. Some organizations might very well offer kind of a visa sponsorship, and I've seen some that do. They say they help with the visa process.
Yeah.
But it is a case-by-case basis. But some of those bigger ones definitely, well, they go either way.
A question for Yavna. Could
Well,
you share a bit about your pathway into working on your PhD and in the public health space at the same time? Doing both at the same time. I'm interested in that too. How are you doing both at the same time, Yavna? How? Sounds like crazy talk.
Yeah. Well, my imposter syndrome is kicking in. But so just a bit of a background about me. I'm from Serbia, and in Serbia you don't get like much opportunities for public health and global health. And I only learned about public health, no, okay, not public health, but global health a few years ago when I joined Multipod Mentorship. And I'm actually currently working within the pharmaceutical industry, so it's not really public health, but I'm trying to make a transition from the pharmaceuticals to global health. And on the parallel, I'm using my PhD and my organization, which is Coalition for Global Health Innovation, in order to make this transition. And I'm also trying to have a life.
And you're trying to have a life.
Yes.
That's tricky. No, that's excellent. I'm always impressed with people that manage to do a PhD and anything else. Like if you're trying to do a PhD and have breakfast, I'm impressed. So to have and not only are you working in the pharmaceutical industry, but you're also heading up a non-profit yourself. Do you want to talk about that?
Yes, join my nonprofit. Kale is in it too. No, just a quick intro about the Coalition for Global Health Innovation. That's organization from young or early career professionals for early career professionals that is trying to offer a non-traditional pathway into bringing innovative solutions to the field of global health and public health and human development, because that's kind of what I'm trying to do with my life too. So that's my life mission and also Coalition's mission. Poetry.
There's nothing like starting an NGO to solve a problem that you are facing yourself. Why not? Absolutely, why not? Here's a question from Raymond. Greg, given your experience, advice on transitioning from a global public health to working in wealthy countries on a domestic health public health. I actually found that quite difficult, to be honest. It was more difficult than I had anticipated, because I'd been working in very senior positions in the global health space. So I'd been, at the World Cancer Research Fund. I was the head of science and research at the Clinton Health Access Initiative. I was the director of EMTCT. And then when I moved to Ireland, I thought, oh, I'll just like find a job in an NGO and kind of and swing into kind of a relatively senior position and take it from there. And that wasn't the case. I actually found it a little bit difficult at first. It took me some time. I decided at that point that I needed to do what I was talking about earlier. As a medical doctor in Ireland, you can specialize in public health as one of the sort of medical specialities. And so in order to go forwards, I had to take a step back. And so I took a step back and I spent 4 years doing the SBR program, which is the training program in public health in Ireland. And that it was a little bit of a, I've disappeared again. Okay, I'll give it 3, 2, 1, and I'm back. Could you hear me talking while I was gone?
Yes.
Okay, just the camera dies. So I came back to Ireland. I did the speciality training, and then and since then I feel as if I'm back on track, and I'm really enjoying my career. If you're not a medical doctor, you don't really have that option. In which case, what I would do if I moved back to a country and I wasn't a medical doctor and that wasn't an option, I would look at the health system. Within the health system, you're going to find it's probably got streams of work that are divided into health protection, health promotion, and then maybe health intelligence. It's within the health protection and health promotion space that you're likely to find the most job opportunities. There might also be environmental health, might be something, but these things may require a very specific master's degree. The other thing that you can do outside of the health system itself, in other words, outside of working for the state, is look at NGOs within the country. So that is something I looked at, and they did exist. There weren't as many of them as I was expecting. Because I was living in Geneva and London before that, which were just swimming with non-profits. Dublin, there certainly were less of them. So that's the third option, is to look at non-profits and what opportunities there might be within that. It wasn't an easy transition, but it's certainly doable. A lot of people are trying to transition the exact opposite direction. They've got domestic experience and they want to get into the global health space. But I, like Raymond, went the other way. I hope that helped, Raymond. Now how do I switch off that? There, right. I tell you what, let's do one more question. And then people's questions, they can leave them in the comments and I'll try and address them in text outside of this particular conversation. But is there one last question that we can just address online, Kale, Yavna?
I can't scroll through the chat, unfortunately, and scroll backwards.
Oh, you can't you? Can you guys see the chat?
I can see it.
Only I can see it. See, unless I switch this on, but if I put that chat on, you only see the new ones. Sorry, guys. Okay, well, if I say, but yeah, I'll answer this. Can you please share a link to the jobs page that you shared earlier? Go to my YouTube channel and become a member. That's how you access that. Look at this. I'll share that one. Javna's doing an awesome job.
No, we actually received quite a lot of nice and encouraging comments. So thank you so much, everyone.
Yeah, the comments have really been nice. I mean, unfortunately, I should have had the comment overlay happening all the time because Kale and Yavna haven't been able to see the comments. Has that been the case the whole time? You haven't seen any of the comments?
I've seen them, just can't scroll on them.
Oh, you can't scroll through them. So here's, do we get jobs in the corporate healthcare sector post-public health degree? Yes. So if you've done an MPH degree, there certainly are jobs that are available in the private sector. And and I would, that's a really good option, by the way. People often sort of think when you talk about public health, it has to be a non-profit or government sector job. I mean, Yavin is working in the pharma industry. I know I've got loads of friends working in big pharma that are doing really interesting work. And, I mean, look at all the vaccines that are flapping around the world today. That is a function of a well-oiled machine in the private sector that is really delivered. So there's a lot. And then there's the other thing is that the big consulting companies very often have a public health consulting branch. And so certainly McKinsey, Boston Consulting, Bain and Company, all of them have got public health consulting branches, and you can go and work for them, and they do super duper interesting work. And if you went and worked at McKinsey and Company for a couple of years, you would just pick up buckets of skills. I mean, really, really good skills that would be useful for the rest of your career, no matter where you landed up. So good question, and highly encourage people to look at that as an option. Both it would be interesting and you'd learn a lot. So absolutely yes. Any final thoughts, Yavna, Kale? Final thoughts for the day? If not,
It's just interesting because I think just saying what we were saying before, there's all different skills that are needed in global health. CGHI is right now looking for a legal officer, but as well in national public health systems, there's always a need for legal people, for HR people, for all sorts of people. So if you just have the motivation,
that's a fact.
That's so much of it. It'll guide you. That's what I think, at least. I don't know. What do you guys think?
Completely agree. Absolutely. Yavna, final thoughts for the day? Wisdom from Serbia.
Well, I don't have any wise thoughts to share, but I'm just really happy that I spent my Friday night in with you guys. It was amazing.
And thanks for participating.
Nice.
People watching this on YouTube, remember you can subscribe to the channel. That's free. If you become a member, there's a cost to that, but there's all sorts of extra bonuses for members. Subscribe, hit the bell notification, and you'll get notifications of future videos. Like the video, put comments, ask questions. Thanks for watching. Don't ever change, don't do drugs. Always do your best. Speak to you soon. Come back again soon. Okay.